Hello everyone. This presentation is on Tang, also called licorice, wheat, and jujube decoction. It is on the California Acupuncture Board Herbal Formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Tang belongs to the category Calm the Spirit. A representative pattern is Tang pattern with emotional fragility, crying, sleep disturbance, and irritability. Important ingredients include Gankao, Mai, Zao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 52-year-old woman with stress, poor sleep, and emotional lability. The current medicines are hydrochlorothiazide, digoxin, sertraline. This case gives a possible reason to consider Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Gankao plus hydrochlorothiazide. The mechanism is that licorice can lower potassium and raise blood pressure. The clinical significance is moderate. My management plan is monitor electrolytes and blood pressure. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is hypokalemia plus digoxin. The mechanism is that low potassium increases sensitivity to digoxin and may precipitate arrhythmia. The clinical significance is potentially serious. My management plan is use caution or avoid if potassium control is unstable. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is polypharmacy in mood symptoms. The mechanism is that patients may self-treat with multiple calming products, increasing confusion about benefit or side effects. The clinical significance is moderate practical significance. My management plan is review all supplements and keep the plan simple. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Tang may be reasonable when the patient truly matches the pattern pattern with emotional fragility, crying, sleep disturbance, and irritability. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.